Good evening. Today we'll start looking on nutritional epidemiology in Jamaica and its public health importance as a part of examining how micro and macronutrients imbalances may affect the public health in Jamaica. I start with this slide that looks on how we go about making change, and this is published by Pekka Pushka. And what it suggests is that as an individual or as a population, we face an uphill challenge in terms of ensuring good health. However, we can begin to make changes in terms of leveling this line as we push this ball, which is the change we are trying to suggest, by making several changes. One of them is an individual responsibility for change, which means that the population or the individual must receive education to help with behavior change. The other thing that is very important is that there is need for changes to the toxic environment. And this can include things like a smoke-free environment. It may look like warning label, food labeling. It may also be improvement of green and open spaces for exercise, as well as promoting accessible and affordable fruit and vegetables to meet the dietary needs. And with this combined individual and policy approach, we can begin to see the changes. And so, this is the model that is put forward as a model to prevent chronic diseases that has been widely publicized since its origin in 2001. Undoubtedly, diet has been an important part of the nutrition and the public's health from a long time ago. And this publication or image here captured by Dinesh Sinha just speaks about diet in the cities and how pervasive at the time micronutrient deficiencies were. One of the things that Dinesh Sinha has put forward is that eating habits have changed over the past several decades, and it has changed to a high fat food from animal source and many processed foods. You have also suggested that the diet quality has diminished with increased fast food consumption and decreased fruits and vegetables. So we're seeing where macronutrient intake, particularly carbohydrates and fat, has increased and sources of micronutrients have decreased. In looking at the Caribbean Commission on Health Development report of 2005, one of the things they showed quite clearly is that there has been an increase in the overall availability of total calories in the Caribbean population since the 1960s all the way up to the 2000s. And so the average household in the Caribbean can now expect to have anywhere between 2,700 and 2,800 calories uh, in terms of availability. The population goal, if we follow the USDA recommendations, will remain around 2,000, 2,200 total calories for the average adult individual. So, what this has led to is micronutrient deficiencies in the population, and this include things like anemia. Now, anemia affects cognitive or brain development in children and adolescents. It also damages the immune mechanism and increase our susceptibility to illnesses. In pregnancy, women often experience complication as well as infants often suffer the effect of anemia. Up to 30% of impairment of physical work capacity and performance has been documented in men and women who are anemic. And so this is an important micronutrient. And in our next few slides, we're going to look at how this has looked or distributed among the Jamaican population. So, for the purpose of the study that I'm quoting from, the Jamaica Health and Lifestyle Survey of 2016-2017, they have defined anemia using the World Health Organization standards, as you have seen here in your slide. So, men less than 13 grams per deciliter, and women less than 12 grams per deciliter for total hemoglobin. And other categories of mild, moderate, and severe are also included. When we look at what is happening in the country, what we see is that almost 1 in 10 men are anemic, 1 in 5 women are anemic, or more than 1 in 5, actually 1 in 4 women in Jamaica are anemic, and this is women between 15 to 74 years old, might I add. And then the total in terms of anemia in the population is about 17%. As you can see, less than 1% is severe, which is a good thing because severe anemia is has many public health implications. But all in all, anemia is still a problem in the Jamaican society. If we look at it by age, particularly in women of reproductive age, what we see is that among the non-pregnant women population, that almost 30% of women in the reproductive age are experiencing some sort of anemia. If we look at the elderly, similarly, almost 30% of elderly non-pregnant women, meaning that they are between 50 and 60 years old, are having some form of anemia. And those greater than 60 years old, just about 16 or 17% are having anemia. So very important statistics here, which shows that anemia is a problem across multiple stages of life in the Jamaican population. So is this cause for concern? I believe it depends on how we look at it. For example, if we look at the line that says 20% is uh, represents a kind of anywhere between mild to moderate concern, we would see that females and females of reproductive age in particular are a challenge or is cause for concern in the Jamaican population. So, in summary, if we take a look at anemia, we see that 1 in 10 of our men and 1 in 4 of our women are anemic. And the problem is important among women of reproductive age and the elderly, where we see that there is some amount of moderate public health significance to the level of anemia that we're seeing. If we then take a look at some of the dietary practices that are perhaps influencing both macro and micronutrient intake in the Jamaican population, we'd see that according to data coming out of the World Health Organization, 1.7 million deaths worldwide has been attributed to or fruit and or vegetable consumption. And so if that is low, one of the things we are sure of is that we might see increases in chronic diseases resulting in increased mortality. Fruit and vegetables has also been linked to gastrointestinal cancer deaths, ischemic heart disease deaths, and stroke deaths. So our diet plays a very important part in providing the macro and micronutrients that we need to prevent pathology. So in the Jamaica Health and Lifestyle Survey, we assessed several things. Food insecurity was looked on, food consumption patterns, special diets, sodium use, and dietary knowledge. I'm going to take a look at a few of the data from this study. And one of the most striking things that we have seen is that if you look on the mustard or the yellow bar in the first column, you'll see that almost 30% of the Jamaican population has what we call or have what we call high or marginal food insecurity. What does this mean? It means that you're looking at almost 1 in 3 persons in Jamaica going to bed hungry or going without food because of lack of money to buy food or lack of food in their household. And so this is a challenge and this is important because again, this is going to lead to macro and micronutrient imbalances. If we look at fruit, which is one of the major contributor of micronutrients to our diet, we'll see that 1 in 4 person are meeting what is considered the recommended daily requirement for fruits. All right, and we look at fruit and vegetables in a sort of the FDA kind of approach where we're saying that you need at least 3 two fruits and three vegetables per day, or a combined total of five fruit and vegetables per day. And as you can see, we're having a challenge here. Is just about a quarter of the population are meeting those requirements. Similarly, for vegetable, again, source of both your vitamins and minerals are affected, because again, we have approximately 2.5% of the population who are not meeting the requirements. If we look at it across disease categories, one of the things that we'll see is that people who are obese, um, the majority of them are consuming suboptimal amount of fruit and vegetables. People with diabetes, similarly, hypertension and high cholesterol. So if we look at the suboptimal line on the fruits, you realize that all of these are upwards of 70%, suggesting that these individuals who have a chronic disease are not consuming enough fruit in particular. If we look at vegetable, situation is a little bit better, but not good. And so what we see is that more than half of persons with these chronic diseases are not getting enough fruit and vegetables on a daily basis. If we look at sweetened beverage consumption, which is a macronutrient imbalance, when we talk about getting too much calories, we're looking at a macronutrient imbalance. And certainly we did speak about our macronutrient, particularly carbohydrate, and the difficulty that processed carbohydrates or refined sugars pose to our health when we think about it from a macronutrient perspective. So just about um, 20% or 1 in 5 of Jamaicans are consuming one or more sugar sweetened beverages per day. And clearly, that will pose a problem in terms of excess calorie and excess processed or refined sugars, which increases overall macronutrient intake and increases risk of chronic disease and pathology. If we look at sodium, which is one of our micronutrients, and oftentimes the imbalance that we see is excess sodium consumption, and just about 8% of Jamaicans report excess sodium intake. And as we can see, significantly more female are consuming excess sodium or salt compared to their male companions or male counterparts. If we look at fast food, again, another macronutrient imbalance. We see that just about 5% of the population have fast food once per day, or more than once per day, rather. And so this is a challenge. This is primarily an issue among our 15 to 24-year-old. As you can look at the blue bar on the 15 to 24, you'll see that it's mainly a problem among our young people. In terms of awareness to what is in our foods, and you become aware by looking at food nutrition labels on packages and being aware of the guidelines that the Jamaican government has put forward to help with choosing appropriately. If we take a look at people's awareness of food labels, we see that just about 40% of them read the ingredients list, and we know the ingredients at least tells you what is in that food. In terms of nutrition claim, uh, the very few, just about 37%, pay attention to nutrition claims. That may be a good or a bad thing. Ultimately, what we can see is that there is some positive finding from the survey, in that people do pay attention to food label ingredient lists. They do pay attention to nutrition claim, and they do read the nutrition facts panel. So people's decision to purchase the food is influenced by these three factors, and by and large, quite a few people are saying that their decisions are influenced by these. In terms of awareness of the guidelines that the government has put forward, just about a third, so 1 in 3 persons are aware of this, which is a good thing, but this needs to be improved. So overall, what we can see here is that there's high levels of food insecurity in the Jamaican population. Few Jamaicans are meeting the recommended fruit and vegetable allowance, which has implications for micronutrient intake, and many are consuming fast food and sugar sweetened beverages and high sodium, which affects both macro and micronutrient imbalances. Uh, this seems to be rooted in people's willingness or unwillingness, rather, to utilize nutrition labels, as well as sources of information on the food they are consuming.